Cristina Marti-Amarista. I'm a geriatric and hospital medicine fellow at Stony Brook Hospital in New York. Now I'm going to be talking to you about an essay I wrote a long time ago, but it was published last year, and it's titled The Fanny Pack Chronicles. So I have no disclosures. This essay was published in the Family Medicine Journal, which is a journal of the Society of Teachers of Family Medicine. And as I mentioned, it was published in 2021. But before going to the essay, I would like to just give you a little bit more of background, let you know a little bit more about myself and my history. So I was born and raised in Venezuela. I'm the granddaughter of immigrants from Spain and from Cuba. However, my maternal grandfather and my paternal grandmother, they were born and raised in Venezuela. So, well, Venezuela is located in South America. We're next to Colombia, above Brazil, next to Guyana, and we see the Caribbean Sea, just a little bit more of geographic context. It's very hot all the time. So Venezuela has many great things, and you know, from nature and the food, etc. But I think that two of the things that we feel more proud of, or I personally feel more proud of, is the fact that we have a public health system and a public education system that spans more than 100 years. And specifically, as the medicine, a school of medicines are all public. There are no private schools, so it guarantees that anybody that has the aptitude and the aptitude to go to medical school and really wants to go, could go, irrespective of their you know, resources. And that's how my father and my grandfather, picture here, who were very, very poor in their childhood, they were able to go to medical school and graduate. My father was a colorectal surgeon, and my grandfather is a psychiatrist. He's 93 years old now. And, you know, with very, very few exceptions in my family, everybody has graduated from a public university, very few exceptions. And there are a lot of doctors in my family. So when I was 16 years old, I graduated from high school and I went to the university. I had to move to the capital. And I went to the Universidad Central de Venezuela, that is one of the oldest universities in my country. And the Faculty of Medicine for this university was founded in 1827. So it gives you an idea of, you know, how well established public education is in my country. So my university, we call it the University City, is all this area. And this was a picture from 1950s when it was first opened. Initially it was located in the downtown of Caracas, but then they moved it here. And this is the hospital where I did most of my training. But, you know, going to the university was in such a young age, it was such a big experience for me, because I have to leave home and I have to, you know, walk through this place that is still amazing. It's a work of art. So medical school in Venezuela, as I mentioned, is free. It's 6 years of medical school, and it's very hands-on. And what I mean by that is that from the first day, you are very close to patient care. You learn at the patient bedside. You always have other medical students that are in other years advanced than you. You have residents, you have the attendings, and everybody is there to teach you how to do things and understand medicine in a very holistic way. So, and that's something that you learn to appreciate, because then you go to the last year of the career, right, of the medical school, and we have something that is called the rural rotation, and you are alone. Basically, there sometimes with a resident, sometimes with another doctor supervising you, but you have to do deliveries, you have to do sutures, you have to see patients in the triage, supporting the residents that are there. So, and sometimes you are the first person a patient sees. So all this very hands-on education comes very handy at that time. So this is a picture of two of the other medical students with whom I did my last, those 6 months of rural service during medical school. And you can see here that there is a fanny pack here, and everybody has a fanny pack there. So when I graduated medical school, everybody that graduates from medical school has to do what is called Article 8. And basically it means that because you study for free, you became a physician for free, you have to return to the country the investment that was made on you. And everybody looks forward to that, because then you are the doctor and you're responsible for everything. And that is like, you know, a big test and a big booster also. So I decided to go. You can go anywhere in the country to do this, and it's 1 year, and it's always in an underserved community. So I was living in Caracas, marked here, and I chose to go to a place called Carayaca, that is in the state of Vargas, and it's a very mountainous area. You can see here, and here is the sea. This is the Caribbean Sea. So this hospital is what I always call at the top of the mountain. So here's, according to Google Map, if you have a car, you can be there from the house where I used to live, my grandfather's house, to the hospital in 1 hour and 7 minutes. However, I didn't have a car. So I had to take a bus to take me from my house to the train station, from the train station, several stops, then take a bus here that will take me here, and then another bus that will take me to the hospital. And as we always say in Venezuela, every year the rain caught us by surprise. So every year there are landslides in this area, some years worse than others. So that year that I started my my rural service, there was a landslide the year prior to that, and the main access to Carayaca was destroyed by the landslide. So they were using an auxiliary, like a road that was only by the private use of the government initially, but they have to open it for everybody because there was no way to get there. So once I took all those buses and train rides, I will get to the hospital, and this is the hospital. And you know, I love that. It was a life-changing experience for me to go there, irrespective of how long it took, and the almost 30-hour shifts that I will have to do. And there I created very meaningful relationships. And you can see here, these 3 pictures are part of what we call the emergency room area. You can see it's something very humble place, and everything was tried to keep clean and organized by the nurses that were amazing. These are some of the nurses. This is another doctor that was doing his rural service. He's in Spain now. This is the first baby I delivered officially as a doctor, like the first day I was there. And these were the other doctors that will share the shifts with me. And this is the back of the hospital, so you see. And every morning I will wake up and I will see a weather like this here in the corner. Of course, as I already mentioned, every time that it rained, we will get scared. And this bus that is here, I was actually inside that bus when there was a landslide and we almost end up in the sea. So when I was there in Carayaca, I went through so many things and I decided to take notes of them and of the things that happened. And some of them were sad, some of them were happy, some of them were dangerous, like the one in the bus. And that's how the Fanny Pack Chronicles came, were born. So when I came to the United States, I did family medicine residency here in New York. And one day, one of the attendants asked to mention a life-changing event as a, after graduating. And, I talk about my experience there and specifically one that I'm going to let you know when I read the essay. So, I'm going to go over the essay. As I mentioned, the Fanny Pack Chronicles, which was published in 2021. I was born and raised in Venezuela, where I also trained as a physician. As a young doctor full of hopes and dreams, I struggled with the realization that the slow-growing cancer of corruption had turned my country's pillars into salt and sand. At patients' bedsides and in moments of need, scarcity was the norm, and that it mostly affected the poor. While learning about medicine and how to do best with limited resources, I realized the importance of the Fanny Pack. After graduating from medical school, I decided to practice in a mountainous rural area near the Venezuelan coast, about an hour away from the closest city. After a bus trip, a subway trip, and 2 more bus trips, I finally arrived at the hospital early in the morning with my fanny pack hanging over my shoulder. I oversaw hospital beds, a labor and delivery area, and served 20 to 30 patients each day. It was exhausting to work 30-hour shifts, yet incredibly rewarding, as I was helping others the best way I know how, through knowledge. The community I served in the mountains was underserved in several ways. On my first day, I noticed the bus had taken an alternative route, and when I asked the driver why, he replied, "A landslide destroyed the main road a few months ago. The government will probably fix it this year." That happened 10 years ago, and it still hasn't been fixed, but that's a story for another day. Scarcity wasn't a stranger. When I had sutures, I did not have saline. And when I have both, there were not enough gloves. "Doctor, that is the only pack of sutures I can give you," was a frequently heard in the modest hospital. My fanny pack had 2 opposing roles. It was a safe place, almost always containing a saline bag, tubes, syringes, sutures, and paper for prescriptions. Simultaneously, open it will bring me back to the sad reality of poverty and want. In times of emergency, this duality was more evident. I remember vividly when one of my patients needed a bag of ringers. A colleague took a bag out of his fanny pack and gave it to the nurse. In the back of our minds were 2 questions. How did we get to this? And why? My fanny pack helped me navigate the sea of scarcity. After my first month in the mountains, I realized that most of the malnourished children, scabies cases, pediculosis, and intestinal parasites, frequently came from an area called El Refugio, the refuge. I did not think much of the name since colorful town names are quite common in my country, and places such as the Lemon, the Little Lemon, and the river were also common among the patients. Still, there was a pattern here, and I decided to volunteer to see the place for myself when nobody else would. How bad can it be, I thought. Once there, I understood. El Refugio was a shelter In 1999, torrential rains caused destruction and death in the area. To temporarily relocate the survivors, the government took an office building under construction and turned 10 by 15-foot offices into apartments. Families had to share a bunk bed and a bathroom where the shower was located just above the toilet. 10 years after 1999 tragedy, the shelter was still under construction, without regular water supply or disposal systems. The residents of El Refugio had been forgotten. Upon my arrival to El Refugio, I saw 2 dogs eating corn on the cob. As I got closer, I realized that what I thought was a dog was an emaciated girl with a bloated belly, covered in dirt, with multicolored stripes in her hair. I had confused a girl with a dog. Even today, this memory haunts me. Still baffled by my mistake, I immediately hurried to work, joining a nurse in a modest and clean room. My first patient was the girl I had seen at the entrance. It did not take me long to realize that ascariasis was one of her problems. I took a bottle of albendazole from my fanny pack and handed it over to the nurse. Once again, and several times after I decided to volunteer at the shelter, my fanny pack played an essential role in my commitment to healing. When I left Venezuela and I came to the United States, I chose family medicine because I knew it would bring me closer to my roots. Upon starting residency, I dusted off my fanny pack only to put it back in the drawer a week after. I realized it only housed pens and gums, and that I no longer needed to stockpile basic medical supplies in case of an emergency. My fanny pack, once again, was bringing me back to a reality, a new reality. When COVID-19 came, the thought, will I need my fanny pack, came to my mind, but fortunately, I did not. Having the opportunity to train as a physician in 2 different realities, one of abundance and one of scarcity, helped me realize that underserved populations, regardless of the latitude, face the same obstacles of a lack of community resources, illiteracy, high medication costs, language barriers. This realization has forged in me a genuine and unconditional pact with my patients to listen, help, heal, and serve, regardless of the resources available. I will continue to be the bridge between health and those in need. My fanny pack faithfully awaits, while I am hoping that no matter where I am, I will never have to use it again. Thank you.
Just